Hello everyone, am I audible? Hello, hello. So yes, myself Dr. Sanjay Khatri. This is FMG 2022. Just a minute, just a minute. So yes, myself Dr. Sanjay Khatri. This is FMG 2022. Just a minute, just a minute. Yes. So yes, we are here. Recall question of pediatrics. Before that, yes, price rise of 20% on 8th June. So it is for light time for you to subscribe Unacademy. Yes, Unacademy is coming with some NEET PG batches. Yes, note down the date. Pediatrics, I will take the class. So note down the date as per your convenience. Come on Unacademy platform and feel the difference. Yes, this is the batch for repeaters. Those who have not done well, not up to their expectation, this is the batch for them. 3 months is the total duration of batch. So why not join Unacademy? Feel the difference. As your choice, you can take plus subscription, iconic subscription with prep ladder, light subscription to see 450 plus test series, and for prof 1 if tell your juniors if they are beginning how to read integrated subjects, so tell your juniors come on this platform, and this is UPSC CMS batch is going on. Yes, all 5 clinical subjects, so everything is there on an academy, live classes. Come and feel the difference. Now this is FMG paper you have done. What you assess the paper level? Simple. I will tell little more than simple. Okay, few questions are very good, that's I am telling in my classes. Yes, FMG now they increase the level, but few are very basic, so you can do those question in I think 5 seconds. So yes, there are few questions from the raw pediatrics, few are integrated. Yes, some question from PSM, pathology, medicine, you can argue whether it's pediatrics or in their column. So yes, we try to discuss all these questions, make a good answer of them. This is for the people who are appear in the FMG exam, they can correct their answer, and those who will appear in next FMG, for them what are the type of pattern FMG is targeting, how can we plan our study based on these tests. Now this was the question. A couple is trying to have a child for past 2 years. After unsuccessful trial, they went for respective examination. Investigation of females came out to be normal, but what is there in male? Male is having gynecomastia, small testes, scanty pubic hair. From somewhere I got maybe agiospermic. So yes, male is having gynecomastia, small testes. Small testes is the key. Delayed puberty is the key. Yes, it is Klinefelter syndrome. So why they not pick so early and they got married and then come into consideration? Yes, this I told in my previous classes. Patient of Klinefelter syndrome remain undiagnosed because they have few signs symptom in individual. Individual is tall, underweight, thin male child. They come to pediatrician or endocrinologist at the time of when there is a delay in appearance of secondary sexual character. Yes, when agiospermia is there, we keep Klinefelter as a diagnosis. Small testes, Klinefelter syndrome as a diagnosis. So yes, no confusion. I hope everybody put it right. Yes, it can't be Williams, Noonans. This is my choice. Maybe you get some different choices in the exam, which I collected from my students. They have given me. But yeah, most of them mention, sir, एक question Klinefelter पे था. This the history. This was the history. So yes, am I clear in this? This is Klinefelter syndrome. This is Klinefelter syndrome. Now, this is the key question. So, I want to know what you have answered in this. A child came for regular checkup in OPD. His growth chart shows weight between 95th 85th to 95th percentile child status is. If we do this question on the raw basis, yes, weight between 85 to 95, it is overweight. But if you see the growth chart of IAP clearly, they say weight criteria from 85 to 97 is overweight. After 97 centile weight is obesity. But recently IAP changed everything. IAP changed everything. They define overweight and obesity based on BMI. So you can argue me, because I know most of my students put overweight, but I feel the correct answer is BMI needed for interpretation. BMI needed for interpretation. So this is the right answer, because IAP changed everything now. IAP, everything is based on BMI. If BMI is 23, it is greater than 95th centile. Yes, if BMI is more than 95th centile, it is obesity. If BMI between 85 to 95, it is overweight. So yes, now nobody can define weight is between this to this centile, whether it is overweight or it is obesity. Now IAP changed everything. IAP says to define overweight or obesity, you need BMI. Yes, because weight we can interpret it with the respect of height. So yes, we can calculate the BMI, then put the answer. Many of you will not agree with me. Yes, they will put overweight, but I feel correct answer is BMI needed for interpretation. BMI needed for interpretation. Yes, 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 I can understand. Now, which of the following vaccines given at birth? 5-second questions. Here, FMG kill all the questions of vaccination. We read vaccination so hard. Contraindication of DPT, open vial policy, vaccination of IAP schedule, all current questions on vaccination, current guidelines. But which vaccine is given at birth? So many years, no confusion. At birth, BCG, OPV, zero dose, and hepatitis B. I hope no confusion in this. No confusion is this. Which vaccine is given at birth? BCG, OPV, and hepatitis B. BCG, OPV, and hepatitis B. Now again, FMG kill this question. Yeah, first dose of hepatitis B vaccine given at birth. So I can't understand the logic. On some ground, they had so tough question. Now, when they ask which vaccines are given at birth, this happens sometime in the exam, which is beyond. Let's see what's the policy. Maybe different people set the questions, different examiners have set the paper. Last year NEET PG 2 question on Turner syndrome, more or less alike. This time, if they ask this question is okay. Which of the following vaccine given at birth? Then why they ask this question? First dose of hepatitis B vaccine given at birth. Given at birth. So yeah, two simplest question from vaccine. These are the two. One is remaining. I will cover that also. So these two are the simplest question on vaccination in FMGE. Now, I think this is the prototype of questions asked in NEET. They asked in FMG. They asked in INICET. All exam contain this question. Alkaptonuria. Yes, urine turn black when exposed to air. Mother will complain, nappy turn black, nappy turn black, urine turn black when exposed to air. What this condition is known as? This condition is Alkaptonuria. Alkaptonuria. I hope everybody put it right. Urine when exposed to air. Urine when exposed to air become black color. So yeah, mother complain, whenever my child passes urine, it turn black. When exposed to air, it turn black. Yes, this is alkaptonuria. Now, they not ask what is the condition. They ask alkaptonuria is due to deficiency of which of the following enzyme. Yes, it is homogentisic acid oxidase. Homogentisic acid oxidase. How is possible? See, homogentisic acid, in the presence of homogentisic acid oxidase convert into malic acid and fumaric acid. If there is a deficiency of homogentisic acid oxidase, homogentisic acid accumulate in the blood and condition known as alkaptonuria. Condition known as alkaptonuria. Yes, alkaptonuria characterized by one feature in infancy, that is urine turn black when exposed to air. In older children, characterized by onchronosis. Yes, this may be next time. Onchronosis, deposition of black pigment in various body tissue. Onchronosis and arthritis, these are the two features present in older children. But yes, this is the feature present in infant. Urine turn black when exposed to children. Older children, onchronosis and arthritis. Enzyme deficiencies, homogentisic acid oxidase. These are some prototype of question they ask in most likely in every exam. So yes, answer this question. Again, this is simplest of question. Crampy abdominal pain, rash, mainly back of her leg, buttocks, as well as extensor surface of the forearm. Laboratory shows proteinuria and microscopic hematuria. What is this? This is Henoch-Schönlein purpura. We prepare for hemolytic uremic syndrome, renal tubular acidosis, post-streptococcal nephritis, nephrotic syndrome, newer guidelines. They come with easiest question. Henoch-Schönlein purpura. Yes, it is Henoch-Schönlein purpura. It's a vasculitis. Another MCQs on Henoch-Schönlein purpura. It's a purpura in which rash present in 100% of the patient. You can't make the diagnosis of HSP without the rash. You can't make the diagnosis of HSP without the rash. Just a minute. Okay, now see, it's a rash, but in HSP, platelet counts are always normal. Platelet counts are always normal. You remember, platelets decrease in all of the following, except always two choices in except. Henoch-Schönlein purpura and von Willebrand disease. Both have platelets normal. Answer this question. Answer this question. 2-year-old boy reported to sub-center with complaint of fever and cough for 2 days with chest indrawing. His respiratory rate is 38 per minute. Next step is, the key point in this is chest indrawing. If you catch this, your answer is there. So what you put? Aditi, Rekha, Dr. Mishra, what answer? What answer you believe? Severe pneumonia, antibiotic and referral. Yes. You need to remember these things. So cough or difficult breathing. What are the signs of clinical assessment? First, remember the respiratory rate. We need to assess child is having sick or not sick. So what is the normal respiratory rate? From 2 months to 12 months, it is 50 beats breath per minute. Okay, if child cut off fast breathing suggest pneumonia are 50 or more till 1 year, and 1 month 1 year to 5 year it's 40 or more. But in our question respiratory rate is 38. I am sure it is 38 given, or you can guide me. Yes, if child is less than 2 months, no, 50 per breath per minute is criteria. Then chest wall in drawing and strider. So these are the clinical assessment. Based on this, so general signs, calculate the rate. Then chest in drawing is there. Chest in drawing given in your question. Chest in drawing given in your question. So yes, it is very severe pneumonia, because chest in drawing, definitely you refer the child, but first you give the antibiotic. You give the first dose of IM chloramphenicol or ampicillin or amoxicillin, but refer urgently to the hospital. So I feel it's a very good question. This I discussed in recently my UPSC class. Yes, if child presented with all these signs, we always concentrate on respiratory rate, but respiratory rate is normal for that age. Okay, 40 or more than 40 is considered high for a 2-year-old child, but chest in drawing is there, so it's come under category of severe pneumonia. When severe pneumonia, need to give antibiotic, and then definitely referral. So yeah, this is a good question. Answer this question. Child complain of palpitation on examination. Irregular radial pulse present, and ECG show absent P wave. What is this? Answer is here. Absent P wave. If a child is having irregular rhythm, until unless prove otherwise, it is atrial fibrillation. So this is a common mistake students make in when they get a case of CHD, rheumatic MS. It's a MS. When examiner describe the pulse, so they describe regularly. No, MS most of the time have irregular rhythm, AF. Okay, then the examiner show me the JVP. So JVP in AF on ECG, P wave absent. In JVP, A wave absent. A wave is due to atrial contraction. When atria contract, A wave comes. But what happens in atrial fibrillation? Atria have no time to contract. They fibrillate with the rate of 300 to 600. So this is the key. Irregular pulse. Absent P wave on ECG, or you can say absent A wave on JVP. It is atrial fibrillation. Yes, so many questions on SVT we have done, but this FMG asks question upon atrial fibrillation. Note down the points to be remembered. Irregular pulse. ECG show absent P wave on ECG, and JVP absent A wave. Am I clear? So these are good questions. Now, have you answered this? Macrocytic anemia present in. So what you have answered? Thalassemia, we have microcytic. Anemia of chronic disease, microcytic, or sometime normocytic. Sideroblastic, again microcytic. Liver disease, we have macrocytic anemia. Yes, in my hemato class, third slide is like this, classification of anemia. Here it is. So macrocytic anemia, you have iron deficiency anemia, thalassemia, chronic disease, sideroblastic. We remember these, but we always pressurize two more, which is more important. Those are copper deficiency and pyridoxine deficiency. Macrocytic over. When we come to macrocytic, Always tell B12 and folic acid we commonly remember, and then liver disease and hypothyroidism. Liver disease and hypothyroidism. Here is our question. Here is our question. Macrocytic anemia present in liver disease. We are prepared for some rare thing. Rare causes of macrocytic anemia. Thiamine deficiency. Lesch-Nyhan syndrome. Orotic acid urea. All of my students know all these causes of macrocytic anemia because we discuss in class so many times. Thiamine, orotic acid urea, Lesch-Nyhan syndrome. But they ask all are the causes of macrocytic, or which of the following is the causes of macrocytic? Alcoholic liver disease, chronic liver disease, hypothyroidism, all have macrocytic anemia. Macrocytic anemia. So I always tell in my classes, B12 and folic acid always remember. 2 disease, liver disease, hypothyroidism. 3 specific condition in which you will get question somewhere. Thiamine, Lesch-Nyhan syndrome, orotic acid urea, macrocytic anemia. Question is there for you. Question is there for you. Neural tube defects show which pattern of inheritance? Yes, this question is due for some time. Yes. Neural tube defects show which pattern of inheritance? Answer. Yes, Rekha, Shushmita, Aditi, Mishra, Divya, what do you think? Yes, it's D. Multifactorial inheritance. What is multifactorial inheritance? 2 genes with additive effect of environment. 2 genes with additive effect of environment responsible for some condition known as multifactorial inheritance. One gene, hypercholesteremia. Another gene, obesity, leads to coronary artery disease. It's a multifactorial inheritance. So always remember, this question is due for some years. This example of multifactorial inheritance. What are the diseases which show multifactorial inheritance? So see, some genes with added effect of environment, one or more gene with additive effect of environment responsible for some condition known as multifactorial inheritance. Now think, neural tube defect, cleft lip and palate, pyloric stenosis, Hirschsprung disease, CHD, these all are dislocation of hip, these all are multifactorial inheritance. We see so many patients of cleft lip and palate. Then parents ask innocently, why this happened to my son? Why this happened to my girl? It's multifactorial. No clear answer is there. So yes, congenital malformations, neural tube defect, cleft lip and palate, pyloric stenosis, congenital dislocation of hip, Hirschsprung disease, congenital heart disease. These all are example of multifactorial inheritance. Multifactorial inheritance. Clear? This is congenital. Adults, what are the conditions? Diabetes, hypertension, coronary artery disease, epilepsy, bronchial asthma, rheumatoid arthritis, multiple sclerosis. These all have no single gene, multiple. Yes, acquired heart disease in childhood and adults, coronary artery disease, hypertension, asthma, epilepsy, diabetes, rheumatoid, multiple sclerosis, schizophrenia. So yes, this I appreciate this question of FMG. Yes, we discuss everything in our class that we know, but yeah, neural tube defect show which pattern of inheritance. Pyloric stenosis show, cleft palate shows, CHD show which pattern of inheritance. Sometimes we are so much buried in autosomal dominant recessive X-linked. Now we are reading genomic imprinting, mitochondrial inheritance, but this is the basic multifactorial inheritance. One more question was there. One more question was there on inheritance pattern. They ask neurofibromatosis. Am I right? Some question is like that. Neurofibromatosis having which pattern of inheritance is there or no? Because few students message me, this was the question they were asking when I was asking for pediatrics question. Neurofibromatosis 1 inheritance pattern. It is autosomal dominant. It is autosomal dominant. You all have so many mnemonics which is dominant and which are recessive. I am not going in detail of this. For dominant, spelling of dominant. D for dystrophia myotonica. O for osteogenesis imperfecta. I for intermittent porphyria. N for Noonan's. A for achondroplasia. N for neurofibromatosis. N for neurofibromatosis. And T for tuberous sclerosis. You all know all these things. Now, which vitamin is deficient in breast milk? I want to listen from you. Which you think? It's definitely not vitamin D. It's definitely not vitamin A. So what you put answer here? But that's why this is the recall question. I am not appeared in the exam. What I receive from the students, so most of them put there in, when I asking, most of them WhatsApp me or on my Telegram personally, they tell me this was the question. So that's why I come with this. Yes, vitamin C is there in milk, but it destroy when we boil the milk. But breast milk contain vitamin K, but very, very less. That's why baby who are exclusively breastfeed having chance of hemorrhagic disease of newborn HDN, it occur due to deficiency of vitamin K. That's why every baby at birth receive vitamin K. If not, baby is put on breastfeed, always risk for hemorrhagic disease of newborn, which occur due to deficiency of vitamin K. Yes, if you want to choose one, which vitamin is deficient in breast milk, you always put answer, it is vitamin K. It is vitamin K. Now, this is a good question. I can say what answer you put in this. Measles vaccination given to baby at 7 months of age. When we give the measles vaccine, if there is epidemics, okay, then we need to give measles vaccine early. Generally, why would choose 9-month age for measles vaccine? Why not on birth? Why not on birth? Because infants are protective due to maternal antibodies through measles till 9 months of age. 9 plus booster at 16. Okay, Divya, I will discuss this also. This, don't worry, I know some people put me booster. So what is the difference between booster 9 month or 9 month? Okay. Yeah, okay, got it. Divya, I got it. So you are telling 9 month and 9th month booster. So I will tell clear this concept. So as per national immunization schedule, at 9 to 12 month we give MR, but as per IAP schedule, at 9 month we give MMR. So first dose generally we give complete 9 month, but you can give till 12 month. Second dose we give at 16 to 24 month. MR, MMR. Yeah, Sahu, I am coming on those questions, Kwashiorkor. Okay, so measles, there is no concept of booster word is there. Booster word is not there in measles. If any chance, this is the chance in epidemics, or very rarely, few books says or few clinicians prefer severely malnourished child give measles vaccine early. But generally, if there is a epidemics of measles, we give measles at 7 months. So when we give the next dose, ideally we should give next dose anytime after 28 days. And in measles case, we don't use the word booster. Whatever you given at 7 months, next dose will be given at 9 months. So yeah, Divya, if one choice is 9-month booster, that is not the answer, because booster word is not used for measles. Booster word generally we use for DPT vaccine. Booster. Yeah. So that's the option were written with word booster. No, we give 9 month. Second dose we will give 9 month, because I got some answer in which they are telling one choice is 9 month, another choice is 9 month booster. So whatever you put 9 month answer. If you have only one choice 9 month booster, then okay, 9 month booster. But my sense says measles vaccine we can't use the word booster. If first dose is given earlier than 9 months, so second dose given anytime after that dose, most likely after 28 days or 9 months of age. So second dose, next dose of vaccine given at, this is the question. I admit we have not discussed in our immunization class. Yes, this is the life, but you have to do, because you are sure that we will not give at 5 year, we will not give at 16 to 24. If you are not giving the 9 month dose, what is the fun to give at 7 month? We are giving 7 month as an additional dose and continue our routine immunization. After completed 9 month, then second dose at 16 to 24 month. हिंदी में सुधीर कुमार हिंदी में बोले ओके बट या हिंदी most of you understand, but English all of you understand. Okay, now this is the question for you. Sudhir, I like your comment. Hindi mein speak kare. Okay, good. I will try. A child having growth retardation, eating less, was taking breast milk until 2 years of age. Child is dull and lethargic. So yes, this is the key. Dull, lethargic and edema. So yeah, it is Kwashiorkor. Kwashiorkor has 3 essential features. Without these essential features, you can't diagnose Kwashiorkor. You can't diagnose Kwashiorkor. What are these essential features? Growth retardation, edema, and mental changes. Mental changes in the form of dull, lethargic child, no interest in surrounding, doesn't play with the toy. So yes, I hope everybody put it Kwashiorkor, because edema is there, dull child is there, lethargic there, growth retardation is there, eating less. What more hint you want, my friend? Yes, it is Kwashiorkor. It is Kwashiorkor. Am I clear? So one question from Kwashiorkor, one question from HSP, Henoch-Schönlein purpura, one question from Klinefelter syndrome. Yes, we learned Down syndrome, Turner syndrome, but yes, we learned Klinefelter also. So that question was Klinefelter syndrome. 3 questions from vaccines, 2 were damn easy, 1 maybe 80% chance we make it right, 9 months. Let's see if our day, that is not our day, that was not our day, we wrong that questions. So yeah, questions look simpler, so few are more there. A child height for age is less than 2 standard deviation. So what is the relation about height and age? That is stunting. If it is weight and height, then it is wasting. If it is weight and age, then it is underweight. So yes, my PM class start with this slide. First, definition of protein energy malnutrition. Second slide, what is stunting? If height is less than age, height for age, stunting. If weight and height, weight is less than for a particular height, then we use the word wasting. And then weight is less than for a particular age, that is underweight. So you should clear this word. This is again a simple question. Child height for age is less than 2 standard deviation. I don't believe anybody put wrong. Height is less, so that is stunting only. Fourth option was SEM. Okay, severe acute mal. SEM. Okay. So Divya, okay, I got it. So this is the question, but yeah, I still feel, and I want your choice again because few people have joined late. So what do you put answer in this question? What answer you put in this question? We will discuss. Forget about exam. We will discuss. What answer you put in this? Yeah, because most of the student put answer 95th to 85th to 95th centile. They put answer overweight. Overweight. But yeah, IAP new guideline suggest you can't describe overweight or obesity without BMI. You should know BMI, then only you can comment. And this 85 to 95th word is given for BMI only in different chart. Yes, these are the word for BMI. If we consider the older chart of IAP, they considered obesity when weight is more than 97 centile. Till 85 to 97 is overweight, but there they specifically mention 85th to 95th centile. Yes, to define overweight or obesity, we need BMI. So I feel BMI needed for interpretation is my choice. Yes, sir. Question was based on BMI. So yeah, Divya, just a minute. Hold on. This is new for me. So this is his growth chart shows that BMI of the child is written in the question or weight of the child written in the question. Whether BMI of the child written or weight of the child written, because now most of the chart based on BMI. So is it weight written or it's BMI written? Answer in the comment box. Answer in the comment box. It was not weight. Okay, so then it's easy. If BMI is 85 to 95 centile, so it is overweight. Then what is the utility of fourth option? BMI needed for interpretation. If they are writing child came for regular checkup in OPD, his growth chart shows BMI of the child is between 85 to 95 centile. It is 85 to 95 centile. It is overweight. It is overweight. Then what is the meaning of D choice? I can't understand. So yeah, I hope its BMI is written because till now I have discussed 95% put answer C. So your question is right. That is more important for me. Okay. So if they put here BMI, a child came for regular checkup in OPD. His growth chart shows BMI of the child between 85 to 95 centile. Child status is overweight. Then it is overweight is the answer. Few more left. Now, one question is there on Bitot spot. I can't claim that's a pediatric question. Bitot spot is there in the diagram. Vitamin A deficiency. Most common seizure in 2-year-old child. Yes, I didn't get the correct all choices, but yeah, it is febrile seizure. We see so many children at 2 years of age with fever. Yes, febrile seizure is the most common type of seizure. Yes, it is febrile seizure. One question was there, niacin deficiency, casal necklace is there. Yes, maybe skin question, but yeah, we discuss all these things, Bitot spots, common seizure, casal necklace in pediatric also. Now, is there this question, tingling sensation in which vitamin deficiency? Tingling sensation, it is in the deficiency of B12, but most of the student telling B12 was not in the choice. If B12 was not in the choice, then I think most probable answer is folic acid. If B12 is there, then answer is B12. Otherwise, folic acid. So what was the answer there? If B12 is there, tingling sensation, we always put first B12. If somebody comes with peripheral neuropathy, tingling sensation, numbness, we just start B12. Okay, so this is the things. This is the thing, because it's a recall. I have not appeared in the exam. I get the questions from what students are writing me, and I appreciate with the so much tension in the exam, still they are what's telling me the questions, they are sending me the question. So this was the question, this was the question. I am really thankful for those students. Yes, that's why I able to make my class now. And what educator get from this? Yes, they have a feeling that 90% questions are there. I never claim all questions are from my notes. No, measles question I have never discussed, epidemics in measles. Okay, so yeah, one or two questions maybe here and there, but reading pediatrics give you a satisfaction. Yeah, that portion is covered, and we will able to answer those questions. Questions on vaccines, questions on PM, questions of seizures, all these questions of syndromes, we can able to answer. Exam is a part. Yes, it's come and gone. Yes, sometimes results matter, but yeah, take it lightly. Just relax for few days and start new. So keep reading. Let's crack it. Trust the God. Prayer for results. Prayer, God at least give us what we deserve. We don't want more, but at least we work very hard. Please give us those. Yes, these are myself, Dr. Sanjay Khatri. If any other questions, options were cardiac arrhythmia, congenital heart disease, hypoxemia, asphyxia. Okay, I will again go and maybe recollect some few questions more. These are the typical questions which I have already discussed, came from the pediatrics exam. If any more, you can send me on my telegram group. Okay, so I can again make a paper, and maybe soon I discuss on Unacademy platform all these questions with some correct answers and correct choices which you are telling me. And this is a sort of discussion. Maybe this is helpful for you also, and those who are planning to appear in FMG next time. It's great help for them. What was the questions last time? They asked which is the first teeth to appear. So one word question is there. Here they ask which is hepatitis given at birth. So these one word questions are always there, and history based question also there. A couple married 2 year not able to get the child, females normal, male show these signs. So these history based questions, image based question, one word questions, all are there. Overall, FMG is a good exam, good questions. So all the best for results. Thank you. Bye bye. God bless you all. Keep posting. If any questions are there, I will try to answer those questions in my Unacademy class. Again, it's a YouTube class. I will take class on Unacademy platform also. Thank you. Bye bye.